Hello and welcome everyone to the EACA online webinar program. I'm Jim Worm, the Executive Director of the EACA and your host for our webinar series. The EACA webinar series offered to our members to assist you in developing new and better ways to build your business, save money, and experience the support of our community. I want to thank you for carving out your valuable time to be with us for today's program titled Controlling Workers' Comp Costs. So please and proud to welcome today's guest presenter, Rob Wilson of Employco USA. Employco has previously presented webinar programs on employee engagement, controlling healthcare costs, and chauffeur safety training. Employco is the largest workers' compensation, loss prevention, claims management, and payroll service provider to the trade show, installation, and dismantling industry. Services payroll processing, which includes filing of report and making the necessary contributions to union health and welfare and pension funds. EACA members not only receive discounts from Employco for their payroll services, they typically save significant amounts of money on workers' compensation costs. With that, let me turn the program over to Rob Wilson. Welcome, Rob.
Thanks, Jim. Thanks for having me on. Okay. So my name is Rob Wilson, President of Employco USA, and I appreciate you guys joining us. The topic, as Jim had said, is controlling workers' comp costs. So we're going to take you through a variety of what is workers' comp to managing your claims to safety to trying to reduce your premiums. So what is workers' comp? How can we reduce the premiums? Loss control, claims reporting, and how to buy in volume, and how to improve your cash flow with workers' comp. So what is workers' comp? So workers' comp is actually an insurance policy that is required by law in every state except for Texas. So Texas, actually, it's optional as a business. So you don't have to buy it there, but every other state is it's required, unless you're a sole proprietor. So workers' compensation, it actually insures for work-related injuries and illness. Some examples are injuries, whether you're falling off a ladder, any type of physical injury, and then illnesses could be something, asbestosis is a great example, or if you get an illness as it's related or subject from your workplace. Part of workers' comp as well, it provides for the lost wages for your employees when they're out of work on work-related injuries. So those typically, an insurance company is going to look at what were your wages for the past, average wages for the past 52 weeks, and will pay you, depending on the state, typically between 60 and 66% up to a certain cap. For example, in Illinois, the cap is $1,300 a week. So if you, depending, for example, trade show standpoint, your wages are higher. Typically, you're going to cap out and you'll max out on the wages. But they look at a 52-week average. It also covers your medical expenses, that doctor's visits, prescriptions, surgeries, any medical-related expenses. And it's paid for by the insurance carrier of the employer. And then the temporary and permanent disability. The temporary is that those lost wages when you're out and the employee can't work, so you're getting the temporary disability payments for your lost wages. And then the permanent disability is for as the employee recovers from the injuries. If you had a fusion in your back or you broke your arm, there's a table that the insurance companies publish that puts a value on different injuries and different body parts, and they come up with what your permanent disability is. And in some cases, if you can never work again, they project that out for the life of your projected age. So so those are your key parts of what it covers. So your cost of workers' comp is it varies state by state. So in the trade show business, majority of the states, the code is furniture insulation 5146, and the NCCI, which is the National Compensation Council on Compensation Insurance, they track claims across the country, state by state, and wages, and then they establish what the average claims are, and they then back into what the rate is. So there's a state formula in each state. For example, Illinois is substantially more expensive than the state of Indiana. So it varies state by state. And there's hundreds of different workers' comp class codes. As I mentioned, the workers' comp class code for trade shows, 5146, it's a lot different risk factor than, say, clerical. A clerical person who sits in their office pays a substantially lower price. And there's hundreds of class codes from restaurants to you name it, there's a class code. So, and then what they look at from a cost standpoint is, what's your claims experience? Have you had good claims experience as a company? And over the last 4 to 5 years, they look at they look at what premium you're paying versus your claims experience, and that'll affect whether you're going to get a credit or potentially a debit on your premium. And then your experience mod. So an experience mod is a big component of workers' comp. Everybody starts at 1, which is 1.0, and then if you have good claims experience, you actually get a credit. So the lowest credit that you can get is a 0.55, which Employco had a couple years ago. The highest that you can go is substantially over 1. We saw a prospect years ago that was in the theatrical business that was a 4.04. So they're taking whatever their premium is and multiplying it by 4. So it's rare that you see somebody over 2.0, but it's a big the experience mod is a big factor in your insurance. And what that does is that looks at, for 2019, you exclude 2018, and then in your formula would be your claims experience in 2017, 16, and 15. So with that data, they look at what your premium was and your payroll versus your claims, and they go through the formula and they establish your experience mod. So it's a very important part of your cost for experience. Next topic, trade show safety. A big part of workers' comp is how safe are your employees. And when we look in the trade show space, and we developed an app a couple years ago that a lot of our clients in the trade show industry are using to help better train your employees across the entire country. So what we're seeing most recently is OSHA is increasing their inspections and fines. So, for example, in California, if you don't report a claim timely, the fine is $5,000. It varies state by state. We had a client that didn't report in Minnesota, and the fine was $300. So, OSHA is really important with their inspections and fines. We also see, from a safety standpoint, the more you can be consistent in training across markets is super important. And the more you can standardize your loss control and safety training, the more consistent that message will be. So that's something, if anyone's interested, we offer the Employco Safety app out to anybody that's interested that has standardized training across your industry. But safety is extremely important, because the goal with safety is reduce the number of claims, reduce the volume, and that helps reduce your premiums. So accident prevention on the safety side, we encourage you to conduct regular safety inspections, and when you do identify a problem, make a correction. That's one of the things that we do whenever there's a claim. When there's a claim, you want to know why it happened, how it happened, and how can I prevent it from happening again. So with that data, you should hold frequent safety meetings. Ideally, with your crew, we recommend, even if it's 5 minutes to 10 minutes every morning before your crew starts working in your different cities, hold a safety meeting. Talk about proper tools, make sure that proper shoes and ladder safety. It's surprising. You're seeing less and less issues with ladders, but it's still a big exposure. So it wasn't uncommon. You walk out on a trade show floor and you see somebody standing on the top step of a ladder. So that's an OSHA violation, and it's also unsafe practice if someone falls from that height. So the more you can include safety in performance evaluation. So one of the things that we would recommend is, as you look at your different cities and your city managers and your foremen, is take into account how you're performing from a safety standpoint. Requires safe housekeeping. From that standpoint, it's always a challenge on the trade show floor, but in the booths you're working in, make sure there's simple things like there's not tape and garbage laying on the floor that people are going to trip over. If there's cords across, make sure they're identified so that you don't have unsafe work conditions. The trip and fall and ladder safety are two of the biggest, as well as lifting are the biggest claims that we see in the trade show business. And look at your equipment. Make sure your ladders your ladders and your power tools are all up to proper maintenance. And get your employees involved. Start an incentive program for your employees so that if they don't have claims in X number of period, there's a reward as a team. So, and then when there are safety achievements, highlight them. Whether it's a company newsletter or if it's just you talking on the floor saying, hey, we haven't had a claim in X number of days in the city. So highlight the safety because it's so important for your employees. Accident investigation. So what happens when you have a claim? So ideally, you want to start conducting an accident investigation. So what happened, how it happened, was there a cause of it? Because if it was caused by somebody else, there's a potential that you could subrogate. And if you subrogate against someone, you're going to recover that claim from somebody else. For example, if one of your employees is hit by a forklift and you're not the general contractor, you're an EAC member, you potentially could go back against the general contractor and subrogate. So drug testing. We recommend drug testing on every claim. In accident investigations, whether it's just like a freight damage or a workers' comp claim. So we strongly encourage drug testing, and we look at what led to that claim and how can we correct it. So our goal is if someone's injured, get them back to work, and we want to know what happened and how you can take the corrective action to avoid it from happening again. So filing claims, when you look at normal claims, ideally you want to file a claim within 24 hours. You want to get as much information as you can of what, how, who, supervisors' reports, anything you can tell your adjuster or your insurance company about the claim, the better. And then fraudulent claims, you want to get out in front of them. We see them from time to time. Within our company, we've had 3 people indicted that were claimants indicted for workers' comp fraud. In order to do that, you really have to have a thorough file. You've got to look at if you can have video surveillance of somebody. The more information you can have, it gets harder and harder to prove fraud, but you can't put up a fraud in your industry. And then your accident reports, they're different forms for every state, but we have a standard claim kit, happy to make it available to members of EACA that you can use across the industry where good to interview your supervisors, the coworkers, the claimants. There's a variety of reports that you can do. And then OSHA forms. So OSHA, if someone is hospitalized, admitted to the hospital, right now that's a federal OSHA reporting requirement. If somebody dies and if somebody loses a finger or arm or any type of appendage, those are all OSHA reporting now, and if you have to report those OSHA within 24 hours, and otherwise the fines can become substantial. So we use a company called MedCore for a telephonic triage. The great thing about that is we have a dedicated 800 number. And anybody can buy MedCore, but what we like about it is you're calling in, you're speaking to a case nurse, and they're recording and asking questions about what part of your body, how'd you do it, so it's a recorded statement. And their goal is, can you self-treat it, or can they send you out to a urgent care in our facility, our PPO network, or if it's an emergency, dispatch an ambulance. So it's available 24/7, any language that that you're going to run across, we have. And as soon as they, whether you use Employco or whether you buy Medco Direct, as soon as that person hangs up, we or you would get a copy of that report. So you end up getting a first report of injury, a transcript of the phone call. They'll also speak to supervisors if you want. But it's a great vehicle to immediately capture the data for a claim, because there's nothing worse from a business owner standpoint than reporting a claim late. So, and it varies by states, but there's the longer a claim goes unreported, the more serious it can be, and the more doubt there is to the accuracy. And as well, what we recommend is someone like Medco or ourselves or your insurance company, if someone gets injured and says, I don't need to be, I'm not hurt, I don't need to go to the hospital, fill out a report and submit it to your insurance company as an advisory only, because that protects your business. That if the person comes back a month later or 6 months later and says, I'm hurt, and your insurance company is going to come back and say, you knew about this 6 months ago and didn't tell us, and it will not be good from your standpoint. So it's called advisory only. So they're not going to set a reserve out. It's not going to go on your experience mod, but you're just telling the insurance company something happened, and we don't think anything's going to come of it, but we want to let you know. And they typically will not. They won't do a reserve, but at least you're protecting yourself when as an advisory only. So if the claim happens, one of the things that we recommend is maintain contact with the person. Follow up with them over the next few days. Depending on the insurance company, Medco is great to report it, but there's some insurance companies that we've seen in the market where they may not reach out to the person for a week, and that's a long time when you're injured as an employee. You want to go to the doctor, you might need medicine, the uncertainty. So the best thing we recommend is contact your employee. It keeps up the morale. Encourage them to maintain treatment. The more you can do that, the goal, of course, from the business standpoint, is get them back to work. And you'd like to close the claim without the employee retaining an attorney. Once they retain an attorney, you can still speak to them, but you can't speak about the claim. So you can speak about employment-related issues, but you cannot speak about the claim. So that's something that keep the conversations going, and your goal is get them back to work. If there are if you run across problems or hear things, or you hear something from another employee saying, I don't think he was hurt, or she was doing something else, she was playing soccer over the weekend, let your claims manager know. So from that standpoint, it can only help you on the claim to keep in contact with your claims manager. The goal then as well is return to work. So ideally, if someone's cleared for work, they can get back to work. If they don't, and as they're going through rehabilitation or therapy, keep in touch with your insurance company, your medical professionals, and ideally, if you can offer alternative work, like a light duty program, is great, because it gets the person back to work, and the sooner they get back to work, the better. So our goal is whenever someone can return to work, they're not at home. They're not. They're getting paid again. They're getting paid their full wages again. So it's a great opportunity to get them back to work as soon as you can. So one of the things that we do on behalf of EACA and our clients is we buy in volume. So when you look at, all right, so I've got a good experience now, I've got good claims experience, how else can I reduce my insurance costs? So what we do is we buy on behalf of hundreds of clients. So instead of buying on behalf of a client that might be spending $5,000 or $100,000 on workers' comp, we combine all of our clients together for buying power. And that the goal is the more people that come together to buy, the cheaper the insurance rates are. So in our case, we're buying on behalf of $375 million of payroll. We spread our risk out, so it's a variety of classes, not just trade shows. But we spend about $9 million on workers' comp after our discounts. So our standard premium is substantially higher than that, but with our discounts, we spend about $9 million. So we're able to get bigger discounts than someone spending $50,000 on premiums. So our goal is to be able to compete with large Fortune 500 companies from an insurance standpoint. So one of the advantages of what we do with the EACA. Improve cash flow. One of the things that we do from an Employco standpoint is you don't pay a deposit with us. With most insurance company workers' comp policies, you pay a deposit, typically about 20%. So if you're starting your policy in June or whatever month, you're going to pay a 20% deposit, and then you're going to pay typically 9 equal installments, and they don't fluctuate. And then at the end of the year, you're going to have an audit. With Employco, you pay as you go, so there's no deposit, and you pay based on a per payroll basis. So if you're busy in April and you've got a lot of trade show work happening, whenever you run a payroll, you pay for that portion of your workers' comp premium. And then come July, if you're not busy, you only pay for the amount of payroll that you run. So from a cash flow standpoint, it evens out your cash flow based on when you're working. So big advantage is the 20% deposit, and the more premiums that you're paying. So when you hit November, not November, July, and you don't have the payroll, you don't have to make a big premium. So key points to remember from our standpoint is report all injuries or illnesses. You don't see a lot of illnesses in the trade show business. That's a little bit rarer for us, but report all injuries promptly. And remember, even if there's not a claim that the person is not seeking medical treatment, do a report. Do a report as a report on. And sorry about that. You're back. And advisory only. Help workers file a claim. The more helpful you can be, the better. Maintain contact with them, and then help them get back to work as soon as they can. And then the more you can do safety and safe practices on the trade show floor, the more that in the long run is going to be to reduce your claims. So, and that's Employco. So we process payroll. We provide workers' comp. We have a great HR department, so we help you with HR issues, and then we do employee benefits for your non-union employees. So that's Employco. We appreciate the opportunity to work with everyone in the trade show business. We've been doing this since 1997. We started in '96, and our first client came aboard in the trade show side in early 1997. So we appreciate the opportunity. We love working with EACA members. Thanks for having me on.
Thanks for the informative session. Anybody that might have a question for Rob would be this is the time to manage anything else you'd like to know. Use the chat box or right-hand part of the screen. We chatted about this previously, Rob. One of the things that that we get involved with on a regular basis, being show management on shows that we work with, copies of members and other EACs, certificates of insurance, workers' comp is one of the areas that organizers and facilities are very interested in, because obviously they don't want to assume the risks of the behavior of the workers on the show floor. You mentioned earlier that one of the other sessions that you guys had presented in the past was about safety. You mentioned that as a big part of controlling costs. Maybe if we just speak to briefly a little bit about the tie it in with the app that you folks have developed that might help some of our members, particularly those that may not have the resources to develop their own internal training programs. What kinds of things you guys have done to help out with that?
Sure. So on our app, you can there's proper forklift usage to proper lifting, trip and fall hazards, working with power tools. So There's 50 different videos. We have harassment training, sexual harassment training for both managers as employees. So pretty wide variety of topics, and it's consistent across. So it's something that you can use in any city. It's all turnkey. So it's been really received well by your industry.
And is the app available through the Apple Store or other places? Where would one find it?
Yeah, so you can find it on Google, the Google Store, and then the App Store for Apple, and it's just under Employco.
All right.
So if you have any issues, just contact our team, and happy to walk you through it.
Super. Anybody else have any questions? We'll give it another moment. Otherwise, we'll just sign off here. But I want to thank you, Rob, again for making the time and putting this together. This recorded session will be available for anybody that wasn't able to view it live. And looks like everybody's pretty well taken care of. I don't see anybody typing or asking questions. Rob, thanks so much for your time today, and looking forward to working with you folks again sometime in the future.
Great. Thanks for having me on, Jim. Thanks a lot.
Thank you. Okay, bye-bye.
Bye.